This is a video to show you how to fill out the med sheet correctly. So first and foremost, you see that she has the client initials as well as the room number here, allergies, when she took care of the patient, your name. Then you move on here, you can see each row is one medication. So this is asking, so she's put on here both the generic and the trade name of the drug. What is the normal dosage? So for example, if this patient was on 200 milligrams, that would be a red flag to me because the normal dosage is somewhere between 10 and 40 milligrams a day. Then you can also see you want to put how it's normally given. Then you have to fill out whether the onset, peak, half-life, and duration. So here you can see the onset is 1 to 4 weeks. As you recall, this is an SSRI antidepressant, so I mean that's even 1 week is probably a little quick, but that's what her drug book said, which is fine. The peak, the half-life, and then the duration. Then you come over and in this column, you're going to put, now you're going to actually go to your actual patient and say how many milligrams are they on, what is the route tablet, or it's a tablet which is oral, and then how often are they on, daily. If this was IV instead of PO, you would then need to include what is the rate. So this should go at 50 milliliters an hour, or if it's a push rate, let's say you're giving IV push morphine, maybe you might have something like, don't give more than 10 milligrams every 30 seconds. You'd want to have something like that on there. The next column here is you need to say, what is the category classification? So the therapeutic category is an antidepressant, the pharmacological category is an SSRI, she spelled it all out, which is fine, and then you have to tell what the mechanism of action is. So right here, you can see that it selectively inhibits the reintake of serotonin in the central nervous system. Then you want to look at, you want to say, why is this patient specifically on it? And you need to be specific. So in this case, it could have been she was diagnosed with depression after having a stroke, or she's been, she's diagnosed as having depression 5 years ago. She could also be on this for anxiety, for example. That is another indication or use of this drug. So you want to say, why is this patient on it? Because there's many different uses for drugs, and you wouldn't want to tell your patient, this is for your depression. They say, I'm not depressed, and then they get all more anxious because they actually are taking it for anxiety. Then this column is where you put the drug and food interactions. Now she did definitely put a good amount in there. You really need to, you really want to just focus on like the most important ones, or especially if there's something with the patient that the patient's already on as well, or common drugs. Like, NSAIDs is a common one. St. John's wort is always another good one to watch with, and alcohol and opioids is also good ones with this drug. Then you want to put down what, if any, labs are there to monitor. So in this case, she said she should monitor electrolytes, specifically the potassium and magnesium. For example, if this was a potassium supplement here, lab data to monitor, you better have potassium written down here. Or if this is a cholesterol-lowering drug, you'd want to be monitoring their different cholesterol levels. All right, next column says most frequent side effects and life-threatening adverse effects. So again, she did write a good amount on here, but she's got the really good ones. Like the serotonin syndrome is a big one that is more frequent. Suicidal thoughts is a good one because that could be life-threatening for sure. Even like this drowsiness and insomnia, that's good because actually with this one specifically, we usually try to give it in the morning because it tends to usually cause more insomnia versus the drowsiness. And so if you didn't know that it could cause insomnia, you might not suggest that a drug that was scheduled at 9 p.m. like this one be switched to the morning. And then lastly, nursing implications. So you want to pick the most appropriate to that client. So you're definitely going to want to monitor her mood and assess for suicidal tendencies. And remember, nursing implications is all parts of the nursing process. So like if this was metoprolol, I would want to make sure I see on there monitor or check blood pressure and pulse before and after dosing this drug. You might have, like if it's a pain drug, you'd want to be talking about monitoring pain, etc. on there. So you can see there's even, I really like that she did a good job. She also has on here assess for sexual dysfunction, which is a good thing to monitor for, but it might not always. One thing too is when you say things like assess for serotonin syndrome, it's also really great to put on here what are things that you'd be looking for serotonin syndrome. Then you can see here's another drug. This patient's also on labetalol, which is a beta blocker. Let's look and see. There it is, beta blocker. And it's antihypertensive, so very good over here. She does have the monitor of blood pressure and pulse. And she also talks about having the patient sit up and those kind of monitoring. Those are all good things. So I'm just going to scroll down because then what I wanted to show you is this last box on here. This says additional scheduled medications client is receiving during hospitalization. So this patient gets Protonics in the evening, which is for heartburn usually or GERD. So she's not actually going to administer this med, but it is scheduled. So you need to write down the name of the drug, the route, the dosage, and then the frequency. Another one, for example, if your patient's on a scheduled sleeping pill, your patient's on Coumadin, those are usually not going to be given while you're on the unit. So those would be things that you'd be writing down here because you might need to monitor the effectiveness of this. They might interact with other drugs. So you definitely need to be aware of all scheduled medications your patient is on. And this is one way that I'm able to know what they're on. So if, like let's say this was, instead you have on your vitamin K injection and then they're on Coumadin, I'm going to be like, something's going on here because these two are fighting each other. We need to talk to the physician and see what's going on. So this is the basics on how to fill out the med sheet.